Hi, and welcome to my channel. My name is Dr. Taylor Burrows. So if you're wondering what the doctor stands for, it's not a medical doctor, it's a PhD. So my PhD is in marriage and family counseling, and I have 2 licenses, one in mental health and one in marriage and family therapy. So I talk a lot about healthy relationships and healthy minds. Now today I wanted to talk about the APA new guidelines about masculinity. Now, the reason why I wanted to talk about this is because it's obviously brought up a lot of emotions from both sides, people who are in support and people who are not in support. And me personally and professionally, I do not think that it is doing us any service in developing healthy relationships between the genders. And I want to kind of explain why, without quoting it or anything, getting too detail oriented in that sense. Just sort of a conceptual, overarching discussion topic today. So even though my licenses and my training is not directly under psychology, I did get a bachelor's in psychology, but my postgrad is in mental health counseling, and my licenses are under the counseling umbrella. So I'm not actually under the guidance of the American Psychological Association directly. Now, I am indirectly because what we use in any mental health profession is based on the DSM. So that's basically what those guidelines are for, is under the classification of diagnoses of mental ill health. Now, maybe on the surface, we look at these new guidelines and think, oh, well, it's not so bad. I think maybe it's okay to see that something is dysfunctional when a man perhaps is presenting as very detached from his emotions and unable to process or express himself in a way that's healthy. Now, sure, I 100% agree that it's important for all human beings to be able to express themselves accurately and to articulate what's happening by being self-aware and then being able to communicate that. But in pathologizing, now pathologizing means making it a disorder, okay? So it's not something that I believe in general. My profession as a mental health counselor, the profession itself was created so that we could step away from pathologizing human beings and natural developmental experiences. Now, this is a whole characteristic of a gender, masculinity. I mean, imagine if it were femininity, right? So if they start saying, if you're too, pretty, or if you're too modest, or if you're too warm and empathic, that's a diagnosis. I'm sure we would have lots of women up in arms about it. So let's look at the other side of it for now, because that's the one that's been passed. So now that we're looking at stoicism and a lack of emotional literacy, basically, for men, which I also happen to believe it's across the board that most people in general have low to, just sort of basic levels of emotional literacy. It's not just men. If we look at it that way, then this is a slippery slope. If we start pathologizing anything that's not perfect, then the hypersensitivity of that threshold is really going to come back to bite us in the nose. So we have to be careful. When we do that, we're basically calling everything a disease. And if everyone's diseased, then what's the motivation to be healthy? First of all, that's just one layer of this that I'm seeing, right? And it's already happening. If you look at, generally speaking, this sort of sick care mentality and people who are sort of living this victimized lifestyle where, oh, well, I'm just overweight and I'm not, feeling well, I'm not doing anything to take responsibility for my lifestyle, which could help to correct certain things about my illnesses that I have, then you're really just, you're enabling that behavior and producing more sick people. And so now if you just sort of heighten that, then you're really taking away the responsibility from the person. And it's more important for each person to be taken on a case-by-case level. Now, when is masculinity a disorder? I'm not sure that it ever is a disorder. Now, I think from what I would interpret the DSM, historically they've used this diagnosis of narcissism. And they've used on the woman's side the diagnosis of borderline personality disorder as a disease, as an illness, as a mental health or mental illness, right? So if we look at those, they're quite gendered diagnoses already. So you see mostly women diagnosed with borderline personality disorder, and you see mostly men diagnosed with narcissism. Now, those are stark extremes of masculinity and femininity embodied in a diagnosis already. So I'm not sure why they're taking it this step further and talking about toxic masculinity in men and boys. So if a young boy, even in that Gillette commercial, you see them doing the same thing, applying the same logic. It's almost like they waited for the APA to put those guidelines out in order to then put this commercial out and have this be justified in that way. But yeah, there are certain things that you need to encourage about the natural development of a young boy in order for him to be successful in life. And there are evolutionary reasons that men are more aggressive or men are more externalized in their behaviors, right? Whereas women tend to be more internalized in their behaviors. So basically, the result of this is removing gender from human socialization. And you see that in a lot of the political efforts to be non-binary and body positive and all those sorts of very liberal, social justice warrior, those kinds of platforms that they use in order to promote acceptability of anything goes mentality. And there's a danger there because when anything goes, you're creating chaos, basically. So if we don't have objectivity, which is sort of the binary-ism, then we become lost. We have no compass. And you can call it moral compass, right and wrong. It's just a duality, right? It's a spectrum. We're not trying to negate the middle ground, right? Everything that's sort of in between and not exactly one or the other is absolutely valid. But without those two endpoints, you don't have any way to define the middle. So I don't know what the fear is in having those endpoints in order to create objectivity. That idea that there is no one particular truth, there is no one objective idea of right and wrong is bogus. That's going to send us into a tailspin as a human race, and it's going to create war and just, hedonism and just chaos. So especially when it comes to healthcare, this is something, whether it's, the faith systems, organizations. Now, there's obviously criticisms and lots of narratives in regards to that I don't want to get sidetracked on. But if we're not going to talk about, religious organizations sort of being the role models for what right and wrong is on a moral basis, let's just look at science in regards to what is healthy and unhealthy. These are all the same types of dualities. So healthy, unhealthy, right and wrong, positive and negative, bad and good. They're basically synonyms for each other, right? They're just polar opposites. Now, healthcare is based on how to create a healthy person. And as a healthcare professional, you're supposed to promote the healthiness of a person and try to reduce the illness of a person. And in order to do that, you need to have an objective viewpoint. You need to have a point of origin in order to work towards something that's a positive outcome to say, okay, you're better. That's the whole point of healthcare. So whether it's mental health, where it's behavioral health, psychological health, physical health, whatever kind of healthcare, that is the ultimate goal. And so this starts to erode that objectivity in a profession that sets the standard for how people think and if it's good or bad, healthy or unhealthy, right or wrong. You see where I'm going with this? So I've been getting a lot of criticism, like very vile criticism, for being objective about what is healthy in regards to sexual behavior and just general relationship behavior. And this is really sad to me. It worries me because, if someone comes to me, it has nothing to do with being judgmental about shaming a person. People come to me in my practice for lots of different things. They could be, a criminal. They could be an offender. They could be completely promiscuous. They could be a sex worker. They could be lots of things that are not healthy, but I still help them. It's just like a physical doctor, a medical doctor doesn't turn away a patient because they may have caused their injury, whether it's through smoking cigarettes or whether it's through doing something really stupid, whether it's due to being, drunk and driving. We don't turn patients away, and we treat them fairly and equally. It's not about being prejudicial, but we as people, one, have to have our own opinions. We're human beings first and foremost. And two, the profession overall has to have some sense of direction of what is healthy. Is it healthy to have one leg or two? Sure, you can live with one leg, and it might be the lesser of two evils if there's something wrong and you need to amputate it. But to say one leg is just as good as two, that's not true. It's an objective reality that two legs are better than one. Now, you can make the best of having one leg, for instance. You see all these people in the Olympics now, or whatever, I don't know if it's the actual Olympics, but they have a competition for persons who have prosthetics, and they're performing amazingly and beating half of people with two legs, so it can be. But as an objective standard, a heuristic, something that is generalizable to the entire population, you have to see it as that point of origin, of a direction, of an ideal. It doesn't have to apply to every single infinite situation or occasion. There's going to be exceptions to everything, but that's exactly what healthcare, or in this case, APA or mental health care, or in my case, sexual health, should be about. Yes, it's ideal to not be promiscuous, and you might interpret that word differently from how I interpret that word, but on a clinical basis, promiscuity is oftentimes a symptom of sexual trauma, but it's not necessarily the only sort of reason someone is promiscuous. Sometimes people are just promiscuous because they like casual sex. And if that's what they want, that's their choice. But it does increase risk for certain things physically, like illnesses, and it does increase problems emotionally and creates difficulties in relationships. So if someone's coming to me complaining about X result in their life when it comes to relationships, and they're doing certain behaviors that contribute to that outcome that they don't like, it is logical to say, well, don't do this behavior as much. So we're getting caught up in this emotional reactivity, and whoever's in control is trying to say, no, it's not allowed. You have to accept all of us the way that we are, and it's just fine. But, every single person has the right to their individual opinion, but when it comes to institutions that are defining objective realities to keep us, in a way, just functioning in order. I mean, if you think about it like legal matters, right? Like the law. If we didn't have the law, we would have social disorder. So this is a similar sort of entity creating a similar kind of law, but in regards to human behavior. So we have to be very careful. Now, I'm sure I'm going to have a lot of feedback from this video, and feel free to put in your comments underneath the video, but please take a moment if you enjoy this video. I will be publishing videos once a week, so hit that subscribe button and go to all the links below in the episode notes if you'd like to reach me and talk to me directly. So that's all for now. Ciao.